there's strong marijuana versus like what is the better stuff, what's the worst stuff. It all depends on the amount of THC that is in the marijuana. So there's a possibility that you can breed enough that the marijuana might not have THC or like a very low amount, so the only purpose is medicinal.
Oh, no. I was just going.
Yes. Okay.
They put like the CBD into like salves and stuff, so like it'll be absorbed through the skin for people with like breast cancer or like lung cancer. It's really nice.
Yeah. So that's why like a lot of people push for medical marijuana when a lot of people are just like it's just a case for recreational use when there are medicinal purposes and there are ways to get to the medicinal part without the drugs part. So since the legalization of marijuana in many states, and I think New York recently just passed medical marijuana, if I heard correctly, yes. Yeah. So since the legalization of marijuana, more students have been turning to marijuana as their drug of choice because the possibility of becoming legal is more, I guess, possible. Yeah, couldn't think of another word. And so from 2004 to 2014, there was an increase from 4.5% of participants using marijuana daily to 5.9%. And despite there being legalization in the state for medical marijuana and also recreational marijuana, it's still a Schedule I drug according to the DEA, which means federally it's still illegal. So if you're crossing state lines, if you're doing things like that with marijuana, you're still doing something that's illegal, even if in the state you're not. And Schedule I means it's the strictest regulations against that drug. So I have a video about K2, which is synthetic marijuana. We're only gonna watch like a part of it because we have more stuff to go through. So this is a piece that was done for the Daily News called K2 in New York City. If I can get this on. Okay, so I might not be able to get the sound, but the first like 15 seconds is what someone on K2 looks like. So.
Can we make it louder?
It is very difficult for a person to suddenly stop using K2. Or they feel the need to just communicate to everybody. So the substance itself is mind control.
I smoke every day. Now I'm addicted to it, so it's not even to get high. It's just not allowing out to have my jobs.
That's how you get around misery and pain. You want me to drive
K2 is synthetic marijuana. There have been a lot of cases where the reactions to K2 for people who have been using have been very extreme. And like you saw in the beginning of the video, it's kind of like a zombie-like state where like they're not really reacting or doing anything until like something happens, and then it could turn into something more. So I have a few statistics on marijuana and driving because there's like a few misconceptions that marijuana does not inhibit your driving abilities. So you increase your risk for getting into an accident 92% if you're under the influence of marijuana. AAA reports that cannabis-involved accidents increased from 8% in 2003 to 17% in 2014. In Colorado, there was an increase in testing positive in fatal car crashes from 5.9% in 2009 to 10% in 2011. In the state of Washington, it rose 122% from 2010 to 2014. In California, it rose from 9% in 2005 to 16.5%. And these are not just regular accidents, these are fatal car crashes. And it is possible to be addicted to marijuana. 9% of marijuana users become addicted to it. And they do have withdrawal symptoms, including irritability, sleepiness, decreased appetite, anxiety, drug cravings. So I'll talk about Adderall for a little bit. So Adderall increases the ability of neurotransmitters such as epinephrine and dopamine. So it boosts alertness, attention, and energy. It also increases your heart rate and blood flow to the muscles. And the feeling is similar to the high that a cocaine user gets. So in the abuse of Adderall, when we were looking at the short-term effects, there were a few positive ones, like increased energy levels, that's what it was, and like lack of sleep, which is helpful for some people that do abuse it. But then those positives are followed by all the other things like nausea and or just the whole list of negative short-term effects. So statistics of Adderall and other stimulant prescription uses among college students is that more than 4 in 10 students say that they have used these drugs in order to study and improve academic performance. 31% just use it to stay awake. More than 1 in 5 abuse in order to improve work performance, so that's like in jobs. And then 27% of those that hold full-time jobs of people who do abuse Adderall and other stimulants have full-time jobs and attend school. So cocaine, they did a study at a large public university. 1 in 8 college students use cocaine sometime during their 4 years of college. By their 4th year of college, 36% of these students have been offered cocaine at least once in their lifetime. And the characteristics of cocaine's high is extreme happiness and energy and mental alertness, which is why people do use it. But what has happened is when we move one slide further, you'll see. But cocaine has a more instant effect because the methods that people take cocaine, which includes snorting, rubbing it into their gums, and injection, allow the drug to reach the brain and bloodstream more quickly. So in the study that was conducted, there has been a decrease in Adderall abuse from 2013 to 2014, but there has been an increase in cocaine use from 2.7% to 4.4%. So that's almost 2% increase from 2013 to 2014. And what people have posited is that people have turned to cocaine more because of the instant effects versus Adderall. So some of the side effects of drug and alcohol use is not mentioned as frequently, and Professor Erica Clefane over here will speak about the effects on sexual reproduction, which is important to know because as people in college, we are always changing our minds about what we want in the future. A lot of people do want kids, a lot of people don't, but the things you're doing to your body now might affect what you are able to do in the future.
Hello, everyone. So, as Miss Wynn mentioned, my name is Erica. I'm an adjunct professor here in the Department of Sciences, and I see a couple of my students here, so yay. But basically, what I teach here is biology of gender and sexuality. So as Ms. Wynn was mentioning, she talks about, the choices that we make now may affect our future in one way or another. We're not necessarily sure what our future is, but it is important to know what types of things that we're doing to our body now and how it can affect the outcome later in life. So basically, what I'm going to be talking about is how drugs and alcohol affect sexual reproduction and pregnancy. So in males, generally we see for alcohol consumption in males, we have this saying that I like to think is prolonged use can reduce. So essentially, the size of the testes will shrink. You'll get a reduction in secondary sex characteristics. So this could include breast enlargement, reduced chest and facial hair, and a shift in fat distribution from the abdomen area to the hip area. And what's most important to notice is that there's this huge drop in testosterone, and my students know that this plays a huge role in sexual reproduction in one way or another. And testosterone can be found in females, but it's basically the primary hormone found in males. And what's important about testosterone is that it plays a large role in sperm development. So when those levels are adjusted, your sperm count can go down. They could be not as motile, meaning they're not able to be as effective in getting to fertilization. So basically, it can make a couple that's trying to get pregnant, it can basically reduce those chances by a lot. And these are, so hormones, specifically testosterone, we know, especially my students know that it's secreted, there's some relation towards the pituitary and hypothalamus gland stimulation. And so as I mentioned before, there's several problems that come up with male reproduction and sexual function. So we have increased infertility and increased erectile dysfunction. For the females, there's a couple of main side effects. Important for sexual reproduction, basically the failure to ovulate. Does anybody from my class want to tell us what ovulation is? Looking at y'all. Just know it. Right, it's the release of the egg from the ovary. So what happens is that your body goes under all these changes and says, hey, I'm gonna lay an egg this month, right? So what happens is that the egg is extracted from the ovum, travels down the fallopian tube and into the uterus so that the egg can be potentially fertilized somewhere along the line there, right? And then, so if that doesn't happen, that decreases your chances of getting pregnant, because if you don't have an ovum to be fertilized, then you're not going to get pregnant. This can also affect your menstrual cycles in general, because it does play a role with affecting different hormones in the female body. There's a couple of side effects, including spontaneous abortions. So if your body does get pregnant, it's your body's duty, basically for the next 9 months, to make sure, can I sustain this child within the womb healthily throughout that whole time? And what can happen is the body says, nope, bye, and it just ejects the fertilized egg. And so this is basically a cause of not necessarily like a one-time alcohol abuse thing, but generally for a female who is pregnant, has continual alcohol consumption, these are some of the results that can occur. Also early menopause, increased chances of breast cancer, increased risk of contracting STD. As Ms. Wynn was pointing out earlier, basically if you're inebriated, you're not going to be in the right state of mind to make choices, so you're more than likely to go through with something that you might not have thought of consciously, such as having sex. So it's really important to note these kind of things. So effects on pregnancy specifically. We see a lot of this stuff happening with like birth defects, and basically what happens is that these effects of alcohol are monitored during the first trimester of pregnancy. So this is the first 12 weeks. And generally this is the most important because, as my students know, this is where a lot of the key functions and development stages go on. You know, we develop the nervous system, we develop the brain, all these other things, right? So if a person is unaware of their pregnancy, they may continue to drink and drink and drink, and then realize at the end, oh crap, I'm pregnant, like what should I do, right? So this is why it's important to talk to your care physician. I was doing these things in the past, I'm not sure about how it's going to affect the outcome of pregnancy. So it's really important to be aware of those types of things. We can also see that there's not just harm done to the mother, but the baby specifically, right? The fetal heart can be affected, the central nervous system, because that's one of the earlier organs that develops on first. And facial features can all be damaged or malfunctioning. A lot of times we see like cleft lips or anything in the facial features that's like dysmorphed. And then also the brain. Obviously that's the most important part, because if you don't have a brain, you can't really figure out the rest of your body otherwise, right? Especially after birth. So we're going to move over a little bit of shift from alcohol to drugs, because it is just as important to realize how drugs have an effect on pregnancy. In females, we generally see an increased risk in lower birth weight, birth defects, changes in physical features, premature birth, and sudden infant death syndrome, which you guys might know as SIDS. Heroin, we don't see, not necessarily in the college setting as much as a recreational drug use, but I thought it would be important to point out because heroin is a huge problem across our nation. And a lot of times we see, famous people, you say this is their drug of choice because it does produce that high. But essentially what happens is that you'll get an increased risk in neonatal abstinence syndrome. There's a bunch of different effects such as opioid dependency, meaning the baby is literally addicted to the drug already, irritability, stomach problems, and seizures. And then for cocaine, there's again effects on the mother and child. With the mother, they usually experience migraines, seizures, premature birth rupture, separation of the placenta from the uterus, big problem because then there could be complications with the baby, and miscarriage. The child can also be affected from cocaine, including low birth weight, smaller head circumference, they'll be smaller in stature, and later in the long run they'll have increased irritability, hyperactivity, and tremors. So that's my portion of this event. Turn it back over to you.
Okay, so this is the point where I'm going to open up the floor to questions, concerns, comments, anything anybody wants to say, because I know there's a lot of information thrown at you, and some of it was a little intense.
Are there any surveys done, particularly at John Day, alcohol consumption, drug use?
I would like to say yes, but I'm going to go with no, because technically John Jay is a dry campus. So,
I used to work at the health center, and the main problem that we had was not drugs and alcohol. It was actually STD contraction, so which I found really interesting. Fun fact.
Yeah.
So you mentioned college campuses have the no tolerance on alcohol. Is that also applicable to your job, right?
I don't know what John Jay's specific policy to that is, because we are a commuter campus, so it's really hard to catch people who have been drunk and things like that. But I would have to look further into that to know. But
Why is it easy to contract an STD, if you are drinking alcohol?
So basically what happens is that if you consume alcohol or drugs, your general capacity to make decisions that you would normally make sober are affected. So you might be more likely to do something that you wouldn't normally
Okay, so it's
be
basically
inclined to do.
you have same sex, but it's not like your body does something that is making it okay.
Yeah.
It's kind of like the cause and effect.
Yeah.
It's more
Okay.
cause and effect than alcohol. It's
Yeah.
equals STDs now. So,